I'm Tim Kleinig, I'm head of the stroke unit at the Royal Adelaide Hospital. We have a big research focus at the moment on intracerebral hemorrhage. Intracerebral hemorrhage is bleeding into the brain, so when a blood vessel bursts, blood escapes from that blood vessel and rips and tears the surrounding tissue, which could cause severe neurological symptoms or even death. So intracerebral hemorrhage only makes up about 15% of all strokes, but because it's such a severe stroke, it causes as many deaths as ischemic stroke. So about 5% of all deaths worldwide are due to intracerebral hemorrhage. And survivors are left with quite severe disability. So overall, 62% of all disability is caused by bleeding in the brain. There are two main forms of stroke. Ischemic stroke, where a blood vessel is blocked and the brain tissue gets starved of oxygen and nutrients. Intracerebral hemorrhage is where a blood vessel bursts and the brain is damaged by the blood escaping into the brain tissue. So we have two main research studies. One is run out of the University of Melbourne called Stop MSU. This is looking at a medication called tranexamic acid, which can stop brain bleeding. That study is looking at people who present very early to hospital within the first 2 hours of onset with small bleeds in the brain. And this medication, we hope, will stop those small bleeds from becoming big bleeds. The other part of our research is looking at people with larger bleeds. This is called the Evacuate trial, we're again running it in conjunction with our partners at the University of Melbourne, and this is funded by the Medical Research Future Foundation. In this study, we're using minimally invasive surgery to create a keyhole into the brain, go into the clot and remove it while minimising the damage to surrounding tissue. Again, we're trying to do that as early as possible to prevent the damage caused to the brain by that expanding blood clot. So we've just completed our phase 2A study that's looking at the surgical efficacy of the study. So are we able to remove sufficient blood clot to possibly make a difference? And also looking at the feasibility of it. Can we recruit enough patients to the study, and can we get people to theatre quick enough to be able to make a difference? That was a study of 10 patients, 5 at the Royal Melbourne and 5 here, and we met our safety and efficacy endpoint. So we're just about to start the randomized controlled trial. We are looking at their outcomes. That's still ongoing, so we're following them up at 3 months and at 6 months down the track. It's very difficult to know exactly what sort of effect that the surgery has had in those patients, because these are strokes which would otherwise often prove fatal. So even surviving with significant disability is better than being dead. But that's why we need to do a randomized controlled trial to compare what people would be like with surgery and without surgery. The idea about removing clots minimally invasively has been around for a couple of decades, but it's really only just recently that we've had the technology that can really do this effectively. And so one of our partners on the study is Integra Life Sciences, who are a large neurosurgical company, and they've developed this device which is like a tiny little tube with incredible optics that you can look into the brain and see exactly what's happening on a microscopic level. And also with the development of that, various centres around the world have started to perform these techniques, and we're collaborating with people in New York at Mount Sinai Hospital who are sort of the early innovators in performing this technique. So and additionally to that, the code stroke processes have meant that we now identify people with stroke very early and can get them to the hospital, get them scanned, and hopefully get them into theatre as quickly as possible. So either you have your scan and you've got an ischemic stroke. We know that unblocking the artery works. We have to do that as fast as possible. So those patients go down that pathway, but we can leverage the process that we've developed to then get the people with intracerebral hemorrhage into that ultra early, minimally invasive surgical arm. We are now commencing the randomized controlled trial phase, where people either get normal treatment or they get this minimally invasive surgery. So people will be randomized like the toss of a coin to either get one or the other. We will be commencing initially at the Royal Melbourne and the Royal Adelaide Hospital, and then we'll roll out to sites around Australia progressively. So all of the major stroke units around the country are taking part. Hopefully in the next year or two we'll be able to expand to New Zealand, to Auckland and to Christchurch, and depending on how things are going, we might expand into Asia and other international sites as well. We need to enrol a minimum of 240 patients in the study. It may be that we need to enrol up to 434, and if that's the case, we'll probably need to go internationally to get those patient numbers. And we hope to have the results of the study in about 4 years' time. The surgeons, Amal Abu-Hamdan is leading the surgical training together with John Laidlaw from the Royal Melbourne. Our collaborators in the US are manufacturing 3D printed skulls with artificial brains and artificial blood clots, and they're being shipped to the centres all around the country. And for each centre we'll have a training afternoon where the surgeons at that site will have the virtual skulls with the virtual clots and have the devices, and with Amal and John's guidance they'll be learning the technique via video conference. There's no doubt that if this trial is positive, and we sincerely hope that it is, that it will change practice worldwide. In certain regions of China, up to 50% of all strokes are due to intracerebral hemorrhage. And as I said, 1 in 20 deaths worldwide are due to this condition. So if it is positive, it could revolutionise the treatment of intracerebral hemorrhage.